Good day, everyone, and welcome to our first Ticket to Work Roundtable in the Virgin Islands. We are really excited to be able to provide an opportunity for beneficiaries, mainly folks with Social Security Disability Insurance, SSDI in the territory. We don't have SSI down here. To provide information from providers who currently have openings in their programs and who would like to work with beneficiaries even if it's in a remote capacity. So my name is Shammi Carr. I'm an advocate at the Disability Rights Center. The Disability Rights Center is what's considered a protection and advocacy program. We advocate for people in every type of disability and almost every type of situation dealing with discrimination. We provide advocacy, both lay and legal, and we provide information referrals, and we also provide training and outreach. Today, that's one of those trainings that we're doing. We are very lucky to have some ticket to work providers with us, which we will shortly introduce. I just want to mention a couple of things before we start. One is that the Ticket to Work program is a program that is by the Social Security Administration, SSA, a program that helps people who are on SSDI and SSI, for those in the States, to return to work in a self-sufficiency capacity, meaning that they return and transition into a situation where they're financially better off and also medically with health insurance when it comes to returning to work when you are a beneficiary. Now, the Ticket to Work program is a program of choice, which means that beneficiaries have a choice to work with whatever program that works for them. It also includes the partnership with the Ticket to Work program. They also need to see a good match with you. So it's a relationship program where the match is good both for the ticket program as well as for the beneficiary. Now, one of the things that people may not be aware of in the Virgin Islands is that because we are an island and because we're already kind of remote, there are a number of ticket to work providers that work with Social Security beneficiaries here in the VI. I reached out several months ago to numerous ticket to work providers to see if they'd be interested in talking about their program and to see if they would like to then do some work with the beneficiaries here in the Virgin Islands. We had a very good response. Unfortunately, with scheduling and other things, we have two of them with us, which we are very excited. We may have another one or two join us, but in the meantime, we're going to go ahead and start the program. So I want to first introduce and have each provider introduce themselves in terms of their name, their title, their agency, and their location, because they are not in the Virgin Islands. Go ahead, Karen, please, if you would like to start.
Sure. I'm Karen Price, and I am a program manager. My agency's name is AHEDD, and we are based out of Pennsylvania.
Wonderful. And Emily?
Hi, everyone. My name is Emily.mowel. I am a manager of Ticket to Work at an organization called Community Integrated Services, also located in Pennsylvania, in Philadelphia, and in Delaware. Nice to meet you all.
Is it an employer in your area that they have a need for hiring? I know where I'm from, we have a lot of warehouses. So if you want a warehouse job, you can pretty much get a warehouse job within a week. But something more specialized or something that's not quite as popular of a job in your area might take a little longer. Other things like scheduling and transportation, if you need a job around a certain hour because of whatever personal things are going on or whatever transportation you might rely on, that can also be a factor. So I know that might not answer your question, but it really does depend in a lot of situations how long it takes to find jobs.
And that's why I kind of put the little caveat before you guys, even mentioned it, because it is really, because there's so many variables, that's why that IWP is so important. And that really lays out what, not necessarily a time frame, but hopefully what that looks like as a transition. Let me ask you, not to put you guys on the spot, but what's been the longest time it took to help someone find a job? What's been the most challenging?
I mean, I would say that at the year mark, I mean, before the year mark, but at the year mark, there's definitely a conversation about what, what's going on that's causing there not to be like us finding a job, right? Like, has there been interviews? Have people like turned down jobs because it hasn't worked with their availability, the pay compensation? What might it be, to see if we are the right employment network for them, or if there is something that they want to look differently for their career, because there are so many factors when it comes to finding a job, right? Like Karen was sharing, like it can depend on what you're looking for. It can depend on what your schedule is, how you're getting there. There's so many different elements to finding the right job. And it's a big choice, right? Like, you're considering getting off of your Social Security benefits that in a lot of cases you had worked to get on. And so it's like an important thing that some people are looking immediately to get a job or looking for the perfect job. So that's a conversation that we would have with the developer. But I would say at a year mark is when we're having a conversation about like if we're the right organization, or if like kind of like what we're doing next, to see if like we should kind of continue in the program together.
Sounds similar to our program too. After a year, we definitely did a check-in. Did happen too often, but it happened enough where you had to be methodical about, because the beneficiary really, is trying, but maybe something just not catching. So thank you, Emily. And Karen?
I would say the same thing for our agency. At about a year, we're having those conversations on what extra supports might be needed, if we're the right fit, and just kind of deciding where to go from there.
And it's a fair question, because as we know right now, and I want to make sure the audience knows that we are in a labor shortage. The Virgin Islands, the governor said last year, I believe it was last year, if we filled all positions that we have in the VI, we still need 5,000 more employees. And that's just Virgin Islands. We know nationally, and I know Karen and Emily are aware of this too, because this is a time where we can really push the agenda for people with disability to fill those spots. What I tell people, particular beneficiaries, is look to see if they have a diversity policy. Look on their website to see how they talk about, the welcoming statement. And this would be a great way to then have that conversation, especially if you have an obvious disability. So, and one thing, just so people know, that Ticket to Work program, if they talk to an employer, they will never disclose disability. That's not allowable. It's an illegal disclosure. But at the same time, you and the Ticket to Work program can talk about how you want to disclose as well. Okay. But I want people to know, as we employment advocates, all of us are employment advocates. We don't disclose to employers when we talk about. We may say we have a diverse applicant, and that's it. Just a little thing on that. All right, I think we have still some more questions coming in. Okay, so how do you meet the paycheck requirements for SSA?
Is that a question about reporting earnings to Social Security?
I'm not sure. Yeah,
For
how do you?
self-employment?
Maybe it's like how are you supposed to report to them?
Oh, okay. And again, that's benefits counseling will address that. There's a form that Social Security uses for you to report your wages to them. And then, then there's the kind of piece outside of Social Security about, just working with an accountant or whoever to make sure you're paying your taxes as you're supposed to. And, those are things that are mostly addressed in the benefits counseling.
I don't know if Emily have anything more to add. It's kind of a procedural thing. Go ahead.
Yeah, I mean, I think the kind of what Karen was sharing is that you're doing your taxes is really important, and reporting that to Social Security, and then kind of what we had highlighted before about just making sure that you're in consistent communication with them, to like notify them that you are doing self-employment work. And then there are some technical forms that you would fill out at that like yearly point with your taxes.
So the main thing, I think the main mantra that we always say at Ticket is, over report. It's better to over report than under report. If you think they got it twice, it's okay. It's better didn't get it at all. So you can work with your Ticket to Work program. You can work with a benefits advisor. You can work directly with Social Security, but just make sure you know what that paycheck requirement, what that cycle, and what those documents look like, so that you don't jeopardize an overpayment and get into a very bad situation where less people can help you. Let's just put it that way. Okay. All right, we've got more questions coming in. I'm going to take two more questions, and we've got two more questions in terms of the program. It says that I found that some remote jobs are scams. Can you comment on what types, classifications of remote jobs are legitimate or plentiful? So what I'll have you, because that's a very broad question, Sandy, what I'll actually have Karen and Emily is, if you can, just speak to maybe the companies or the type of work that you do see that's legitimate, that you're already supporting through your Ticket to Work program.
I would say, like, if it's a business that you recognize, I'm thinking of one person I have. She works for a nationwide credit card that everyone's heard of. You know, that's a legitimate work from home job. So she's doing troubleshooting, help desk type thing, maybe a little bit of sales. You know, when you call the credit card phone number, you know, it's ringing to perhaps her. So if it's a company you have heard of and you're familiar with, that it's a real company, that they just happen to have a remote position, then chances are that would be legitimate. If it's a company you've never heard of, if they're asking you to send money in order for like a startup kit, that is a red flag. You can also get like on Indeed or even just a Google search, you know, searching the company legitimacy or reviews, and you might get a little bit of a sense that way if it's a scam.
Yeah, I mean, I think that those are great points that I've discussed with people when they have had those questions. I think definitely communicating and talking to your job developer, if you are in the program, to discuss some of the remote positions that you have. I always encourage people to look at the employer's website. Indeed, I think I'm sure that they do have kind of processes to check job listings, but I think that you are right to see that there are scams there. And so checking other platforms like Glassdoor, seeing if like the website, like the organization that's hiring has a listing on like their official website, is another way of kind of identifying if it's legitimate or not.
And anyone who's interested, DRCVI actually did during the pandemic, we did a whole training on remote work. And Emily mentioned one of them, Glassdoors. We actually have a listing of all the different remote job listing job boards. So if you're interested, please let me know, and I'd be happy to forward the training to you, so that you can see some of those boards. Flexjobs.com is another one. There's probably about a dozen of them that are legitimate. So, and some of them are specific for people with disabilities as well. So please do let me know if you'd like that training forwarded to you. We have more questions coming in. Okay. Let's see. Pay stubs. Okay, actually, let us go back to, in terms of the questions that we have for the presenters. One second. So the next question I have for you, and Karen, if you want to start, having to do with kind of the peripherals of Ticket to Work. We know that the Ticket to Work is the core. We know the benefit advisor's core, but sometimes we have some peripherals like reasonable accommodation or assistive technologies. So I'm wondering if you could speak to your partnership or your in-house supports that you have regarding reasonable accommodation in the workplace, including assistive technology.
So we do ongoing assessments of accommodation needs. You know, it really is a spectrum. Sometimes an accommodation need is just needing to take a longer break or have a slight change in a schedule. Something like that, we can definitely help the beneficiary talk to their employer about what the accommodation it is that they're asking and how to ask for that. If it's something along the line of assistive technologies, we cannot pay for that. If somebody were to need assistive technology, we would look to see if there are any resources or providers that would be able to provide that.
Okay, wonderful. Emily?
So the conversation about accommodations starts in our intake. It is something that we discuss to see if there are any accommodations that someone may be considering or thinking that they may need. It is something that is in the individual work plan that was mentioned, but it is kind of like a ongoing, thing. Sometimes people get a job and then they want to discuss accommodations because they realize that they might want one. And that is something that some employers know that we exist, and some employers, a lot of employers in my case, don't know that we exist. And so we kind of talk about how to navigate that conversation if they want us to be involved in that conversation when it comes to accommodations. When it comes to kind of assistive technology or other things, kind of similar. Our funding is limited. We're not able to help with that. We would connect people to resources. I'm thinking of one example. It's kind of in the same line of someone that wanted an accommodation to their car. And so in our case, VR does help with things like that. And so instead of continuing with the process, they first went to VR to get that done for their car so that then they could look for a job. So we definitely want to make sure that people have the resources that they need. And so in some cases, we're not able to provide that. And so we would connect them to the right one.
Wonderful. And just as an FYI, Disability Rights Center is an affiliate of the Northeast ADA Center, and I want to mention them. They're part of our sponsors to provide information on the ADA, all aspects of the ADA, including Title I, of course, which is the employment provision. And so the ADA Center is a national program, and their number, and Kishma, if you wouldn't mind putting it in the chat for me, is 1-800-949-4232. I myself worked at the Northeast ADA Center at Cornell University. That's how I got to the Virgin Islands. This is a great resource. And so any Ticket to Work provider, whether it's through the Ticket to Work program itself, or the Ticket to Work provider refers them, say, hey, give them a call, the ADA Center, and ask them about reasonable accommodation. That's a great resource. Again, another free one. And it does cover the territories as well. We have it here in the Virgin Islands. Again, we are an affiliate of theirs. And I also want to mention the assistive technologies. That is a national program as well. It's we have one, and we have actually one of the staff with us with the Virgin Islands University Center for Excellence in Developmental Disabilities, Ms. Sharon Williams, who also heads up the assistive technology. And that is something, again, as a national project. So if people need that, that's available nationally and then locally in terms of specific counties and so forth. Okay, so lots of resources. Okay, so we still have more questions. So we have one last question for the program. I'm going to save that for a few. I see the surveys in the chat, but we still have more questions. So let's keep on going since people are very inquisitive, which is wonderful. Okay, so we have a question. Does the individual receiving benefits have to recertify? If so, how often? And I don't know if Karen or Emily, you want to speak to this, because I know this is a general question as well with continuing medical reviews.
If it's about continuing medical reviews, everybody's on their own timeline for that. So some people will get a medical review every 3 years. Some people it's longer. I will say one of the benefits of Ticket to Work is if your ticket's assigned and you are making progress towards your goals, you are able to waive the continuing medical review, which is a nice benefit. You do have to continue to fill out any work reviews that Social Security might send. Again, that's just kind of to cover your bases and making sure they're getting all the information they need to have about your work, your employer, your wages. So the work reviews do continue through Ticket to Work if you're working, but the medical reviews can be waived.
And that's a very good point. And, you know, for us with the ticket program, if someone literally came up and said, well, I don't want to deal with medical reviews, that can't be the only reason to join Ticket to Work. But as Karen said, it is an extra benefit that you don't have to worry about recertifying because you are meeting timely progress. Emily, did you have anything more to add to that?
I don't think so. I mean, I think just like kind of reinforcing what I had mentioned earlier, and I think what Karen just touched upon is like making sure that you're filling out the paperwork that's requested of you, but that there are certain protections. And I think just talking to your benefits counselor as you're getting Social Security paperwork, if you do have any questions, or if you just to share it with them so that they can help you.
Wonderful. Looks like we have a couple of more questions. What is the percent of individuals have problems with being overqualified? So I don't know if Dawn, are you asking if the Ticket to Work has beneficiaries who are overqualified for positions? And I don't know if we can unmute Dawn's mic to clarify.
Hello, can you hear me?
Yes, Dawn, go ahead.
Okay, I just wanted to know, when we were talking about various issues, if you've seen a lot of problems with individuals who are overqualified attempting to get services, and if so, what would be that percentage?
We've never turned anyone away for being overqualified. You know, if you're overqualified for a job, that's kind of the employer's determination. But, you know, we've had people who have worked, I mean, have excellent job histories, like 30, 40 years of job history, and suddenly need assistance for whatever reason. And if that's the case, you know, we look at their past employment, their skills, and try to get them a job that's going to meet their needs. But I don't think we've ever like determined somebody to be overqualified for our program.
Okay, that's good. Thank you.
Uh-huh.
Yeah, I would agree. In the same sense, I don't think that there has ever been a case. I think that there are people that sometimes kind of do have a long career in a certain field and decide to transition. And so sometimes that can, you know, we may have to discuss with the job developer, how can we highlight what they have, like what skills they have for this new field that maybe it looks like they're overqualified to an employer. But that's never, I feel like we've always found success with people finding jobs that they're interested in ultimately. So it's never been a major problem.
And I think just to add to Dawn's question is that we do see people who may have, as Karen mentioned, years of experience or degrees, and all of a sudden they're starting over again. And so they feel like they're kind of hitting a wall because it's like, but now I have a disability, you know, I'm on benefits. And so, you know, even though I've got all this experience, you know, it's not matching up. And so I'm sure that's Dawn what you mean in terms of being overqualified, even though you can't get those doors to open. So, okay, I think we just had a hand raise. Is it Angelica? Oh. Okay, we have one more question, looks like in the chat, and then I'll ask the last question for the program. And this looks a little bit of repetitive, but I want to make sure we ask it. Do you have the beneficiary report themselves, or do you send their pay stubs to SSA? So actually, this is a good question. We talked about reporting, but this is a good question, and this is actually one of the questions I tell beneficiaries to ask the Ticket to Work program. Who will submit the stubs to SSA? So Emily, you want to start first?
So ultimately, it is the beneficiary's responsibility to report their pay stubs to their local office. We do assist people with kind of learning how to report. Some people, you know, in the case of something last minute where there's a barrier, you know, I've assisted people with faxing it in over the phone, like we've talked about it. But ultimately, we review the pay stubs and submit it to the Ticket to Work program, and then the beneficiary also reports the pay stubs to their local office. benefits in whatever means they determine would be best, whether it's online or email, or not email, regular mail, or over like fax. But we help people navigate that and learn how to report if they haven't before.
Yeah, that's great. And I'm glad you said, Emily. Ultimately, it is the beneficiary's responsibility. I've talked to numerous, and I'm sure Emily and Karen can attest to this, that people have come and say, I thought you submitted it. No, I thought, no, 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 no. Ultimately, and again, that's why that IWP is so important. Everything's spelled out. And just like Emily pointed, we will help you troubleshoot. We will be there certainly to support you. But ultimately, at the end of the day, because if you go to court for an overpayment and you say someone else was supposed to do it, that's not how it works. It is the responsibility of the beneficiary. So I just want to hammer that point a little bit more. Okay, Karen, how do you guys do reporting?
Same thing. It's we train and counsel people on how to do it. I think where some of the confusion comes in is for the Ticket to Work program, one of the agreements between an EN and beneficiary is the beneficiary needs to send pay stubs to the EN every month. That's how we verify earnings and get funded through Ticket to Work. So they're like, well, I sent you my pay stubs. And it's like, yes, we need a copy, but you also have to make sure you're sending a copy of your pay stubs to Social Security or reporting online. And again, that's something that we counsel people on how to do that. But ultimately, we want people to be independent and be successful. So we want them to be able to take charge of that for themselves.
And some people may ask, well, why do I have to give the Ticket to Work pay stubs if I'm giving it to Social Security? But Ticket to Work is also a program of Social Security, so they need it for their administrative purpose as well. So some beneficiaries might say, well, that's duplicative. And it's like, no, they have a reason they need it for Social Security because they have regulatory things they need to do. And you also have your own regulatory things you need to do to make sure you report it directly to Social Security. So both have responsibilities in that respect. Okay, wonderful. I think what I'll do at this point is I will ask the last question of the program, and now we'll just open it up to the last questions that you have before we start closing it up. So the last question I have, and again, when we tell beneficiaries the choice program, you have to ask these questions to different Ticket to Work programs. One of the questions I always think is important is, what makes your Ticket to Work program unique? What is it that makes you feel like you stand out where I would want to join your program? So Karen, I'll start with you first.
I think what makes AHEDD's Ticket to Work program unique is employment is the only thing our agency does. We have been providing employment support since the 70s. And we've always, as an agency, had a culture of accountability and performance. Our participants' success in their job is our success too, and we want to work as hard as we can to make sure somebody is successful. So when we joined the Ticket to Work program, we already had kind of that culture and expectation at our agency that we are about performance, we are about outcomes. We do want people to get jobs and be at a substantial earning level. So that's just kind of how we have been operating even prior to Ticket to Work. And joining the Ticket to Work program has just been a real benefit to our agency, and we look to expand and help other people find success.
I think long history, accountability, success of clients and outcomes, you would sell me right there. So that's great. That's awesome. Thank you. Emily?
Yeah, of course. So I would say that our goal is to help the specific person. So everything is customized specific to the beneficiary that we're working with. So when it comes to the job search, it's individualized. We're not going to try to propose jobs that someone's not interested in. When it comes to benefits counseling, it's personalized. So we're going to only provide kind of guidance on your specific situation, understand and talk to you with compassion, understanding that you are able to make the best decision for yourself. And we understand that ultimately sometimes, you know, working at that substantial level isn't ultimately what some people want. And so I think that we navigate things individually and with compassion to help people meet what their ultimate goals are.
Well, you said one word that definitely is very important, and that's compassion. I think we can all attest whatever field we're in, whether it's disability or otherwise, we meet very jaded people. And how are we supposed to, you know, uplift people if the person that's serving them is not in the best spirit and are jaded? So compassion is very important. And, you know, you can know the job, but if you don't have compassion to help, it's going to fall flat. So thank you for that, Emily, for sure. I'm going to open it up one more time for questions as we start to close up. But keep an eye on our events page, and we will keep you apprised of additional Ticket to Work, not just roundtables, but training programs as well. Some of the stuff that we talked about today, for example, was the safety nets, which is very important, and it gets a little bit detailed. Again, that's a different training. And then in terms of also talking about if you know folks who are on benefits, who don't want to or can't get off benefits, Emily also mentioned that sometimes circumstances people don't get off. It could be because they don't want to, or their own disability precludes them from getting off. And so we talk about that as well. Even if you're still on benefits, there is a benefit to work. So with that, I want to hand it over to Karen and Emily one more time for parting words. Karen, I give it to you.
This has been a lot of fun. I have learned a little bit from you, Shammi. I wrote down that number for the Northeast ADA Center. And I'm excited for to work with you closer, and everyone that came here. I thank you for your time.
Great. Let me also mention, before Emily gives her closing, is that DRCVI is an advocacy organization. So we advocate to empower people to make their own decisions. And when we started this event, we said that the Ticket to Work is a choice program, but we can suggest providers. We know that Karen and Emily have functioning abilities to work with people in the Virgin Islands. So I just want to be clear that nobody endorses any Ticket to Work providers, but we certainly provide those referrals. So thank you, Karen, for that. Emily?
Yeah, I want to thank everyone for having me. I always like talking about the Ticket to Work program. I've had family members go through it, and I see how helpful it can be. And I think that it's, you know, great that you're able to host this and people can ask questions about the program because it does have a lot to offer. And I believe that my contact information will be shared. So if anyone has any questions or want to have a further conversation, I myself am not someone, I feel like I'm like a one-on-one person. So I understand if questions come up later on and you want to talk about it, I'm here to discuss. Thanks, everyone.
One of the things that the Ticket to Work programs do is they do a lot of outreach. And so this is one of the ways that they do outreach. And we were lucky to be able to then have them join us today. So thank you both for your time, for your information, and for what you do as well. And I have to say, when I did Ticket to Work back in 2011, we were in a recession, post-recession, and I didn't even know what the Ticket to Work program was. But I know one thing, it was a great 4-letter word. It gave a lot of hope. And that's what this program does. It gives hope to the beneficiaries that yes, you can work again. And yes, you might be able to not be on benefits and being caught up in all these systems. So I thank Karen and Emily and all the people who do Ticket to Work to provide hope to the beneficiaries that yes, you can have life after you become disabled if that's what you dealt with. So, and on that note, I want to also thank Kishma, Nadia, who's helped, Rebecca. This again was a team effort, just like you guys. You work with teams, we work with teams to make this happen, to bring this information. That's what we do at DRCVI. Make sure that the people, the community of the Virgin Islands, both St. John, St. Thomas, St. Croix, Water Island, know that we are here to help you. We're here to give you information referral. I myself am an employment advocate. I've worked with many of these systems. So if you don't even know where to start, give me a call, email me, and I'll help you get you to the right folks who can help you. With that, thank